Thanks very much, Samantha. As you said, my name is Angela Voulgari. I'm delighted to be here and thank you for the invitation. I am the lead officer for the Equally Safe Edinburgh Committee, which is Edinburgh's Violence Against Women Partnership and is also leading the Women's Safety in Public Places Community Improvement Partnership. So I'll give you a whistle-stop tour of how we are working towards a public health approach to women's safety in public places in Edinburgh. So if we can have the next slide, please. A very brief background. This work officially started in April of 2021 when there was a motion at full council on women's safety in public places. And the ensuing report was submitted to the Policy and Sustainability Committee in November of 2021. And if I can summarize that report as briefly as I can, it recognizes that men are more likely to be victims of violent crime in a public place, but they're also 3 times more likely to be perpetrators of violent crime in a public place as well. We highlighted that it's not only violent crime that instills fear of public places, but also the fact that rape culture and misogyny and wider gender inequality actually places the onus on women to keep themselves safe in public places. And we can't forget that fear of public places, regardless of whether somebody has actually been affected by abuse and violence in a public space, still affects their options, their choices, their well-being, their decisions, how accessible they feel a public space is, and also how welcome they feel to exert ownership of that space and for it to feel like home for them. Ultimately, and we can't emphasize that enough, is that the design of a public space alone is not responsible for violence against women. Gender inequality is what's responsible for violence against women, and we can't emphasize that strongly enough. Next slide, please. So the Women's Safety in Public Places Community Improvement Partnership, this is an interagency partnership with members from Police Scotland, particularly the Prevention, Intervention and Partnerships team, the Public Protection Unit and Domestic Abuse Investigation Unit, and the City of Edinburgh Council, which includes the Equally Safe Edinburgh Committee, Community Safety, Public Safety, 20-Minute Neighbourhoods, Smarter Choices, Smarter Places, and more recently we have been joined by public transport providers as well as a number of third sector colleagues. And the partnership itself has 4 subgroups, which are intelligence mapping, evidence-based practice, women's safety on public transport, and communications. The reason we chose to create a community improvement partnership is because we are then able to directly report to the Edinburgh Community Safety and Justice Partnership, which directly oversees our work. So next slide, please. What is the ultimate goal of this work? Really, what we're hoping to do is to integrate equally safe principles within place. And I say place in quotation marks because this is the name of our directorate within the council that deals with all matters to do with the design and accessibility of public spaces. How we can do that, we are looking at work that is currently being undertaken, for example, the pedestrianisation of George Street, more recently the expansion of the tram network, the low emission zones, the changes in 20-mile limit on some of the major arteries throughout the city, but also engaging with partners who are specialists in these areas. And particularly, we've worked closely with the women's safety team within Atkins, who have produced the Get Home Safe report, which I would highly recommend to anyone who's kind of looking for a quick overview of those principles. The other piece of work that we're undertaking as well is look at what plans we already have and how we can actually embed a gendered view of those plans. I'm not going to list all of them, but they are all linked in the presentation. So there's actually quite a lot that's already being embedded and that we can actually influence to improve women's safety in public places, the perception of safety. Next slide, please. The most recent activity we undertook was a public consultation called Women's Safety in Public Places. And really, we were interested in finding out what women identify as factors that help them to feel safe in a public place. And any actions that we wanted to take forward, we wanted to make sure that women who live, work, commute, study in Edinburgh actually had a say in what we actually recommend as actions going forward. I must state that we did have support and knowledge shared by partners in West Lothian and Glasgow who had already done consultations around this topic. We were very fortunate to gain some learning from them and their experience. The Your Police survey as well. And also, E-Division was very kind to share with us crime data from crimes that had actually been committed in public places over the last 5 years as well. And these are all contributing to a wider picture in Edinburgh. And the final report following the consultation, which took place over the summer this year, went to the Policy and Sustainability Committee again on the 1st of November of 2022. Now, apologies, I actually forgot to add the link to this, but if the slides are to be circulated, I'm more than happy to include the link so that people can go and have a look at the actual report itself. So next slide, please. Some of the key findings, we had 1,461 responses and 94% of respondents were women. The three key factors determining how safe a public space feels for women is lighting. It came up again and again and again. How quiet or busy an area is, and also the behavior of men and young people in that area. Now, there's a bit of a caveat to this because those actually often counteract each other. So women told us that, I feel safer in busier areas, but if the busyness is due to, stag parties and men who are coming out of pubs, drunk, maybe behaving aggressively, then actually I feel less safe. So there's a bit of a kind of counterbalance to those two that we need to take into consideration. We were told that over 95% of respondents took measures to feel safe when alone in public spaces, but we also need to highlight that these were heavily gendered. So it wasn't things like just being aware of my surroundings or not wearing my earphones when I'm walking alone, but things like making sure I have a pair of flat shoes in my handbag, or making sure to wear a longer skirt or not to wear clothing that people might find quote unquote provocative. So yeah, the gendered impact on this has been really significant. The more alarming outcomes that we had from the consultation was that the majority of respondents actually had experienced harassment, abuse, or violence in a public space in Edinburgh. We're talking between 76 to 82%. 89% of those who had experienced violence or harassment or abuse did not report it. Most alarmingly, 95% of people told us that they would not report a crime in public space to the police. So if we can go to the next slide, we actually asked people if you would or would not report, why would that be? And some of the reasons they identified is things that we can actually act on, which is hugely significant. So not knowing where or to whom to report, thinking that it's not important enough to report or that it's part of life. And this is where we really see the influence of culture and misogyny and how deeply gender inequality is embedded, to the point where a lot of women think that I'm just expected to put up with this behavior, so why would I report it? Many women stated that the incident itself was too traumatic to report and they just wanted to forget about it and put it past them and move on. Whereas others said that they expected the reporting process itself to be too traumatic and not really worth the pain and emotional energy and resource that will go into reporting. Again, we were very saddened to hear that women had very little confidence that anything would actually change if they reported, but also that many people did not actually know what constituted a crime. So, for example, is being groped a crime? Is being catcalled a crime? There's still a lot of a lack of clarity around these issues, and some actions that we can certainly take to raise awareness of what constitutes a crime in a public place. Next slide, please. As part of the consultation progress, we ran the consultation process. We ran focus groups, and it was very interesting to actually run those because that free-flowing conversation actually enabled us to observe how people talk about these things and what recommendations they have. So the key findings were very similar to the general consultation in terms of what helps people to feel safe. People actually made suggestions actively, such as, we always hear about crimes in public places where things have gone horribly wrong, but we hardly ever hear about where things go right. So when somebody has reported a crime and the perpetrator has been committed and we've had a successful prosecution, for example, We could improve publicity for support services as well as various different methods for reporting. And it could be anything from police reporting to third-party reporting to Crime Stoppers to the new SARC centers, for instance, and how people can access support. But also a suggestion for more places or spaces where these conversations can be held. And this was particularly important because we specifically ran one focus group for men because we really wanted to see how men talk to each other about these things. And we were very heartened to see that, men were actually more than happy to challenge each other whenever somebody would, present a view that felt, well, I'm not a threat, so I don't understand why any woman should should feel that I'm a threat to her in a public place. Other men would jump in and say, well, that doesn't matter because it's not about you, it's about how that person feels, and so it was very interesting to see that, men were saying, if we could have more of those conversations, I think we could help women to feel safer. And that was really quite eye-opening for us. Next slide, please. So what next? Again, cannot emphasize this enough. Design a public place or redesigning or planning a public space alone is not going to resolve violence against women. We need to go deeper, but that doesn't mean that our work is in vain. We can still work to make spaces safer by design. So what we're going to be doing is we're going to repeat the consultation on a smaller scale in January and February of 2022. And that's because we appreciate that in the summer we were missing certain key participants, such as students, for instance. We know that the nicer weather would have influenced people's responses to the consultation. So we want to repeat it again in winter to see whether there's going to be any changes. We are planning a campaign targeted at men's attitudes and behaviors towards women, especially in public spaces. And we wanted to make a concerted effort to see what's the most effective way for us to share different ways of reporting, where, how, and why to report, and also make sure that people know what constitutes a crime. We will be analysing mapping data that we obtained both through this consultation as well as through Police Scotland to help us to target prevention and interventions, and also to work with additional stakeholders such as Lothian buses, Edinburgh taxis, nighttime economy venues, and so on and so forth, because we realise that these are all aspects of public life, and as such, they will have a role to play in women's feelings of safety or lack thereof. So, next slide, please, just to say thank you very much, and I'll be here for any questions later on. Thank you.